I hope you're doing well today. Just to start out with introducing myself, I'm Megan Vogel. I'm a full-time community health worker for Interlakes Community Action Partnership in Madison, South Dakota. I got my Bachelor's of Science degree in Human Development and Family Studies from SDSU before I started here, and I just started here at the end of September of last year. Just to give a little bit of a background on the development of the ICAP CHW program, one thing that you should understand is that the community health worker program is brand new pretty much to the entire state of South Dakota. So there are a bunch of other nonprofit organizations and healthcare organizations that are getting community health worker programs right now. So myself and my manager, Mandy, we've been collaborating with leaders and other community health workers across South Dakota through this state program called CHWSD. And there's a website for that too, if you want to check that out. It's just chwsd.org. ICAP thought that this would be a wonderful program to start here because ICAP realized that we didn't really have any programs that focused more specifically on health. We definitely had some programs that touch on health, like Head Start and Early Head Start, with working with the families and the children. There were some areas of that, and a lot of the work that the community service workers here do is a little bit touching on health, but there was nothing that focused solely on health. So that's why we decided to start this program here. Currently, we are getting our funding through a grant, and that grant has been extended now into next year, but we have also applied to be able to get reimbursed through Medicaid. And Mindy and I worked together on that. It was a long process to fill out that application, but we got that done a while ago, and now we're just waiting for a response. Another thing that Mindy and I have both done, well, yes, Mindy's already done this, and I'm currently doing this, is going through classes online through Southeast Technical College in Sioux Falls, so I can get certified as certified community health worker. And the reason why we're doing this is because in order to be able to get reimbursed for our program through Medicaid, it's required that we get an actual certification. And also, it's just always going to be beneficial to have more education underneath our belts. In addition to going through classes through STI, Mindy and I have also gone through the Better Choices, Better Health program, which taught us how we could teach a class on chronic disease self-management to clients. So now that we've gone through that class, we will be able to present that to clients once I start seeing clients in addition to Mindy. The very best way that I know of to describe who community health workers are is to use the metaphor of a bridge. We are really a bridge between clients and health services. We aid clients who may struggle to manage their health conditions or access health services so that hopefully they can overcome those struggles that they face. We serve clients who have chronic health conditions or face barriers to health services. We won't turn anyone down, but we will primarily be working with low-income poverty individuals. And we will help them get onto Medicaid if they're not already on it. And we would hope that many of them would be on Medicaid, because in order to be able to get reimbursed through Medicaid, all our clients need to be on Medicaid. But we are also currently looking into other different types of health insurance, possibly being able to reimburse the community health worker program. So that could be a possibility down the road. These are many of the chronic health conditions that we can help clients out with right here. So as you can see, some of the really common ones would be diabetes or mental health conditions, cancer, high-risk pregnancy, obesity, just to name a few. And you can kind of look at that a little more just to see what all those are. And then these are the barriers that clients may face to being able to access health services. Clients may be living in a really rural area where there just aren't many health resources, or where they might lack transportation to be able to access health services, or clients might have a lack of technology, which makes it difficult for them to find and get in contact with health services. Or clients may also face a language barrier to accessing health services. For example, someone's primary language might be Spanish or some other language that's not English. And as we all know, many of the health professionals here in the state of South Dakota speak English primarily. Now, some of them can be bilingual or multilingual, but those can be harder to find. So as CHWs, we can help to translate what medical providers are conveying to clients whose primary language may not be English. Right here is a flow chart that I created that shows the process of how we work with clients from the very moment they are referred to our CHW program, all the way through until they have achieved their health goals and are able to leave the program. So I will just let you kind of take a look at that, just so you can start to get kind of a picture of what we do. So when we first start to know of a client, the way that happens is through the referral process. So you, as a community member, or as a health professional, or as someone who may be an ICAP employee or associated with ICAP in some way, you should be on the lookout. Any person you see who you think might benefit from our services, you can refer to us. And the way that you go about that is, first, you should call or talk to your client or this person that you think our services would benefit. And you should see if they are interested in our services. And then if they are, you should reach out to us here at ICAP, specifically to the CHWs, and then give us their information so we can get in touch with them from there and hopefully take them on as clients. So then from there, the ICAP CHWs, we will then enter the client into our system if they aren't already a client of ours. And we will fill out this form that we have called the Universal Data Form. That's basically like an intake or onboarding sort of form. We'll fill that out if we need to. And then we will send a care plan to the client's medical provider for the medical provider to sign. And then finally, once the medical provider has filled out and signed the client's care plan and sent this signed form back to us, we will then be able to work with the client on their health goals. This is a picture of our care plan right here. And as you may be able to see, it has a place there at the bottom of the form for the healthcare professional to be able to sign. So this acts as the healthcare professional's referral of the client to our program. We need to have a signed care plan for all our clients who are on Medicaid in order to be able to get reimbursed by Medicaid. But we have decided to have a care plan filled out and signed for all of our clients, regardless of whether or not they are on Medicaid, just for the fidelity of our program. And another possibility is they may start out in the program not on Medicaid, but then we may be able to quickly help them get onto Medicaid anyway. So we just decided it was a smart route to have this filled out for all of our clients. Once we start working with the client in our community health worker program, there are all sorts of things that we will be able to do or can do for the client. We can help the client get onto Medicaid if they are not already on it and they're eligible for it. We can work with the client to set health goals for themselves and help educate the client on their health conditions as needed. We can refer the client to other resources or programs that may aid them. We can attend medical appointments with the client as needed if they need that support, or maybe they need someone to translate for them. We can help translate information that medical providers are conveying to the client if that is needed. So that could be either spoken or written information that medical providers are sharing with the client. And some clients may just be having a difficult time comprehending the medical information that they are receiving. Even if it is in the same language, we can still give them the aid of understanding medical information. And then finally, we will provide the client with transportation to medical appointments as needed as last resort. We really do want that to be a last resort. We would like to try to help our clients find some other route to go for accessing their medical appointments, whether that be relying on family members or friends for transportation or finding public transportation. We would go that route first, and then only if none of those would work out would we then provide them with transportation. And then this is just a picture of the goal form that we will fill out together with the client that we're working with to help them set health goals for themselves and then create strategies that they can use to meet those goals and then to note their progress on those goals. We have decided that with each individual client that we're working with, we want to only have them set 3 health goals because we just realized even those could be really big goals, and just to keep it more manageable, we want to start out with 3 goals and focus on that first and then see where we go from there. So then basically we will just continue working with the client for multiple sessions, however many are needed, and following up with the client until they have met their health goals and they are able to move forward. Because our entire goal with this community health worker program is for our clients to become more independent in managing their health needs.